Winter is associated with a higher risk of heart attacks, strokes, and heart failure episodes. The rise in blood pressure, thicker blood due to mild dehydration, and increased strain on the heart all contribute to this. People tend to be less active, gain weight, and sometimes skip medications during holidays, all of which add risk. For the elderly or those with heart disease, this seasonal stress can be significant. Blood pressure often rises in winter because cold temperatures make our blood vessels tighten, a process called vasoconstriction. Cold weather can worsen hypertension as well. When the skin senses cold, the body tries to conserve heat, and the blood vessels become narrower. You can keep your blood pressure and hypertension in check in the colder months by following simple hacks such as staying active indoors or outdoors and dressing warmly. Why does blood pressure rise in winter? During winter, temperature drops. When the body senses cold, it tries to retain heat. This causes blood vessel constriction. Cold air makes your blood vessels shrink, known as vasoconstriction. This increases resistance to blood flow, causing blood pressure to rise. 2. Reduced physical activity. People move less in winter. Less activity plus slower metabolism equals higher blood pressure. 3. Increased stress and hormone changes. Cold temperatures trigger the release of adrenaline and cortisol. These stress hormones can elevate blood pressure. 4. Higher salt intake in winter foods. Winter snacks, soups, pickles, and packaged foods often contain more salt. Excess sodium is a known trigger for high blood pressure. 5. Weight gain. Many people gain weight during winter, which can increase cholesterol, raise blood pressure, affect heart health. Tips to keep your blood pressure under control in winter. Dress warmly, especially covering head, ears, and hands, to reduce sudden vessel constriction. Stay active indoors or outdoors. Even short daily walks help maintain vessel flexibility. Limit high-salt foods like soups, pickles, packaged snacks, and restaurant meals. Stay hydrated, as dehydration thickens the blood and raises pressure. Monitor your blood pressure more frequently, especially in the morning when readings are higher. Avoid sudden exposure to cold, such as stepping outdoors immediately after waking or bathing. Acclimatize gradually. Continue all prescribed medications, and avoid skipping doses during holidays. Prevention is always better than cure. Elderly people can grow more awareness about their health in winter with certain tests. Dr. Tail recommends the following tests for elderly to monitor their blood pressure and hypertension in winter. Regular blood pressure monitoring, at least 3–4 times a week. ECG if there are symptoms like chest discomfort or palpitations. Kidney function test, creatinine, electrolytes, once or twice a year, as hypertension affects kidneys. Lipid profile yearly to track heart risk. The experts also mention some more winter-specific tips for the elderly. Keep rooms warm but well ventilated. Take a few minutes to warm up the body before going outdoors. Ensure good hydration even if they don't feel thirsty. Check for dizziness or imbalance. Cold weather plus multiple medications can worsen it. Maintain a regular routine for meals, sleep, and medicines to avoid pressure swings. Who faces the highest risk in winter? Winter is especially risky for people with chronic hypertension, heart disease, diabetes, previous heart attack or stroke, obesity, kidney disease, elderly patients, above 60 years. If you fall into these categories, winter requires extra caution. Winter-related complications for blood pressure patients. Uncontrolled blood pressure during winter can increase the risk of 1. Heart attack. Cold weather puts extra pressure on the heart, raising the risk of cardiac events. 2. Stroke. A sudden spike in blood pressure may lead to blood clots and brain hemorrhage. 3. Arrhythmia. Cold temperatures can trigger irregular heart rhythms. 4. Worsening of kidney problems. High BP affects blood flow to the kidneys, worsening renal function in winter. Common symptoms to watch out for winter blood pressure spikes can be silent, but watch for headache, especially back of head, chest discomfort, dizziness or fainting, breathlessness, palpitations, nosebleeds, blurred vision, swelling in feet or hands. Seek help immediately if symptoms worsen. Here are scientifically backed tips to protect your heart and control blood pressure during cold months. How to stay safe. Winter blood pressure management tips. 1. Keep yourself warm. Wear layered clothes. Use socks, gloves, and scarves. Avoid stepping outdoors early morning. Keep room temperature comfortable. Warmth helps prevent blood vessel constriction. 2. Monitor blood pressure daily. Use a home blood pressure monitor and track readings every morning. Before bedtime, record values and share them with your doctor. 3. Stay active indoors. Even if it's cold outside, try indoor walking, yoga, stretching, light workouts. Just 30 minutes daily can significantly reduce blood pressure. 4. Watch your diet. Avoid winter foods high in salt, sugar, oil, processed preservatives. Prefer fruits, oranges, bananas, apples, vegetables, spinach, carrots, beetroot. Warm soups, whole grains, nuts in moderation. 5. Stay hydrated. People drink less water in winter, but dehydration raises blood pressure. Target 6-8 glasses daily. 6. Limit caffeine and alcohol. Too much tea, coffee, and alcohol increases blood pressure and heart strain. 7. Reduce stress levels. Practice deep breathing, meditation, gentle music, short breaks at work. Stress hormones are major blood pressure triggers in winter. 8. Don't skip medications. Many patients skip doses due to laziness or cold weather, but winter is the worst time to do this. Take medicines regularly as prescribed. 9. Regular checkup with your doctor. Cold weather brings unpredictable changes. Get blood pressure evaluation, ECG, cholesterol and sugar tests, if needed. This helps prevent complications early. When should I see a doctor? Seek immediate medical help if you notice BP consistently above 140/90 mmHg, sudden chest pain, difficulty in breathing, severe headache or confusion, numbness on one side of the body, irregular heartbeat. These could be signs of a severe blood pressure spike or heart/stroke emergency. Winter is beautiful, but it can be dangerous for blood pressure patients. Cold weather naturally increases blood pressure, putting extra stress on the heart. The best approach is prevention. Stay warm, eat healthy, stay active, and monitor your blood pressure regularly. If you or your family member has hypertension, follow these tips to stay safe throughout the winter season. Winter increases the risk of heart attack, stroke, and sudden blood pressure spikes. People with hypertension, diabetes, or previous cardiac issues should be extra careful during cold months. The normal blood pressure range remains the same year-round, around 120/80 mmHg. Even in winter, readings above 130/80 mmHg should be monitored, and above 140/90 mmHg require medical attention. Dehydration thickens the blood and reduces circulation efficiency, which can increase blood pressure. Aim for 6-8 glasses of water daily, even in winter. The best time to check blood pressure in winter? Once in the morning, before breakfast. Once at night, before bed. Make sure you are relaxed and seated for 5 minutes before checking. Which climate is best for people with high blood pressure and why? A mild, moderate climate, neither too hot nor too cold, is ideal for people with high blood pressure. Extreme cold causes blood vessels to constrict and raise pressure, while extreme heat can cause dehydration and rapid changes in heart rate. A stable, comfortable climate helps the blood vessels stay relaxed and reduces sudden fluctuations in pressure. Please subscribe, like and share.